This is Dr. Weinstock. There was a question about low-dose naltrexone and the leaky gut, period. The leaky gut is really best referred to as increased intestinal permeability. Leaky gut, although it's well descriptive, it's just not as scientific as increased intestinal permeability. You will find references to both if you just search pubmed.com to look for articles, but it's vastly noticeable when you see just how many more articles are given that term. Basically, with increased intestinal permeability, the junctions between the epithelial lining cells is disrupted. There are changes in the levels of zonulin and includins, proteins which bind the matrix between the cells and help tie things together. There are other factors involved as well, which are more complicated, but nonetheless, when there's disruption by drugs such as nonsteroidals, heavy alcohol use, or most commonly dysbiosis or bacterial overgrowth, then you often will get increased intestinal permeability. Other factors such as radiation or chemotherapy or other toxic phenomenon that will disrupt the gut lining. So what happens underneath the epithelial lining? Well, in the submucosa and lamina propria, which are anatomical areas below the epithelial lining, we have inflammatory cells that are brought into the location because of inflammation that occurs, and toxins that try to enter, such as bacterial shell coatings, such as lipopolysaccharides or LPS. And what this does is attract dendritic cells, which then attract mast cells, which then, with an array of chemicals that come out of the mast cells, attracts lymphocytes. And the T cell lymphocyte, or T cell, will secrete microparticles, which activates the mast cell, which then activates the T cells and B cells, and we have a vicious cycle. And the T cell releases cytokines, which are chemicals that cause inflammation, and that inflammation will cause more damage to the epithelial lining and a greater increased intestinal permeability. So if we could do something about the instigator, the mast cell or the T cell, or even the B cell, which secretes antibodies, then we have hopes of improving intestinal permeability. There have been no studies to document this theory, but it makes sense. And when I see patients with irritable bowel syndrome with bacterial overgrowth, and they have extraintestinal manifestations such as restless leg syndrome, chronic fatigue, muscle aching, I will automatically give them a prescription for LDN, and they often get better. With respect to using it to heal the gut lining, once again, we need studies to document this, and that has not yet been done. Nonetheless, LDN has a special spot for patients with significant inflammation and alteration in their gut lining integrity.